Conducting VAN properly. Weakness is the essential question. Why? It's the middle branch of the MCA. It affects disability scales and outcomes for independence. It warrants the risk of endovascular treatment because there is permanent motor weakness. So that's the first thing we do. We have you put up both arms and hold them up for 10 seconds with palms up. And you can refer to our video on how to do this, right? But we have you mark how severe it is, but you don't score it. If you have any weakness at all, then you go on to do the vision, aphasia, and neglect. If the patient shows no weakness, patient is VAN negative. We put this for our ED physicians, and because people around the country and the world miss basilar arteries. Someone is confused or comatose with dizziness and focal findings. You know, these are patients you should consider basilar artery thrombus and do a CTA. But I'm talking about awake patients that show no weakness and they're VAN negative, right? So that's the first thing. If they have no weakness, you're done. If they have weakness, then you test the visual fields. We test the 4 quadrants, okay? And then we have you have them look toward the right, towards the left, and just see if their eyes are uneven to pick up a double vision. I picked up 2 top of the basilar strokes with a minor weakness and basically a double vision. Their eyes were disconjugate from the VAN exam, okay? Then you test for aphasia. We all know how to do this. I never count slurring of words because that can happen from a pure motor weakness. If somebody is talking like this, but he's able to talk, guess what? He's either drunk or has a pure motor weakness, okay? I'm talking to you, I'm understanding you. So the first thing we do, repeat 2 objects. I usually use my watch and a pen. Then I have you follow 2 commands. Close your eyes and make a fist. And then I have you repeat something, okay? Today is a sunny day. If you can't do any of these, then I mark which one it is and say you're positive for aphasia. Anytime you have a weakness plus aphasia or weakness plus vision loss, you're automatically VAN positive. You don't have to be vision positive, aphasia positive, and negative, and neglect positive. Anything with motor weakness, you're automatically VAN positive. So if you have motor weakness plus vision loss, you're VAN positive. Motor weakness plus aphasia, you're VAN positive. Motor weakness plus neglect, you're VAN positive. Neglect, so you just look at the person. Do they have forced gaze to one side, or they have the inability to go past midline? So if you're standing on the left, can they not go look past the midline? Or if they're standing on the right, they can't look towards you, okay? And then you have to touch the right hand, then the left hand, then both hands at the same time with their eyes closed. If they tell you when you touch both hands, they're only feeling the right or only feeling the left, that means they're neglecting you touching both sides. And that's the entire VAN exam.